inflammation. So these advice I'm giving you, like the people who developed pre-symptomatic states, and we have to prevent them going into the severe states. And vitamin B6, which is much helpful for the lungs to transfer oxygen. And these are the natural ways to cleanse your lungs. And many people all know they are following it regularly, daily. So the dentist, okay, who are all more exposed to the COVID-19, okay, so because they very closely they go to their patients' oral cavities. So they, I have advised the dentist to take regularly steam therapy. Okay, regularly steam therapy once they come to home after the cleaning. Okay, so even if you have virus or whatever it is, this is natural way to cleanse your lungs. So steam therapy, I think most of you all know this. There are lots of WhatsApp video on this. So the second thing is controlled coughing. So controlled coughing is the body's way of naturally expelling toxins that it has trapped in the mucus. Controlled coughing means what? You have to practice that. No, it is like you have to cough and then you have to control it. Okay, you have to cough and you have to control. So that is the controlled coughing, and that loosens the excess mucus in the lungs, sending up through the airways. So people can follow these steps to cleanse the lungs of excess mucus. So you can sit down on a chair with the shoulders relaxed, keep both feet flat on the floor, fold the arms over the stomach, and slowly inhale through the nose. And slowly exhale while leaning forward, pushing the arms against the stomach. Cough 2 or 3 times while exhaling, keeping the mouth slightly open. Okay, so you can follow this technique. You can advise your friends, whoever has got excess mucus in their lungs. So you can tell this technique and you can ask them to practice this. And you have to repeat, give a rest and then repeat. So postural drainage, as the previous speaker also, Dr. Vishnath Reddy told. So postural, I am not going to talk in detail about all these things because that is out of my topic. So, but simple postural drainage techniques you have to know as a physiotherapy student. You all have to know this. So on your back, I'll just show the picture. So this is for the upper lobe anterior segment. Now you can keep one pillow under the knee, and the other thing is side lying. You can make 1:2 breathing pattern and continue for a few minutes and repeat on the other side. And this is on your stomach. So basically, you have to make concentrate the middle lobe, upper lobe, and the lower lobe, supine, side lying, and the prone position. Okay, so this simple technique, if you do a percussion and cupping and then the tapping, that will reduce the excess mucus into the lungs. Green tea. Okay, so green tea contains many antioxidants that may help reduce inflammation in the lungs. And advise this, please take green tea, so that will help to reduce the inflammation. This slide is about to control the lung inflammation in the severe states. So green tea is one of the best advice to take to control the lung inflammation. And a recent study involving more than 1,000 adults in Korea reported that people who drank at least 2 cups of green tea per day had better lung function than those who drank none. Anti-inflammatory foods. These are all anti-inflammatory foods, anti-inflammation of the lungs. Okay, so inflammation of the airways can make breathing difficult and cause the chest feel more congested. And foods that help fight inflammation include turmeric, okay, leafy greens, cherries, blueberries, olive oils, walnuts, beans, and lentils. Okay, so these foods will help to reduce the lung inflammation. Chest percussion. Okay, you can do chest percussion, and that will dislodge the trapped mucus in the lungs. You can use a cupped hand and rhythmically tap the chest. So combined chest percussion with the postural drainage can help clear the airways of excess mucus. Okay, alarmingly, after discharge from hospital, some patients return viral positive and others even relapse. Okay, so in the month of April, May, okay, I got one one news from the Maharashtra. Okay, so one of my friends. So he was repeatedly tested 4 times. Okay, repeatedly tested. He was discharged from the hospital, but again repeatedly tested, and he turned 3 times positive. Okay, so 3 times he turned positive. So some patients return while discharged from the hospital. So what is the problem here? Virus eliminating immune response, and all this is the COVID-2 virus is a totally new virus for the healthcare professionals. So still research is going on, and all the researchers and the doctors, the healthcare professionals, they are comparing the old virus, okay, the influenza virus and then the chickenpox virus, and they're slowly trying to link this virus and then the symptoms. The problem with the patients who are returned from the hospital, you have to advise them to use a separate restroom and use a separate, no, because the virus always shed through excretion. Okay, the virus always shed through excretion, and then you have to separate wash basin for goggling and for brushing your teeth. So tell them to be isolated. That's the reason government advise them to be in home quarantine after they discharge from the hospital. Okay, so some patients, serious patients, they tell them to be in home quarantine for 14 days. Okay, after discharge from the hospital. So this is very important for COVID-19 patients, and those recovered from the non-severe stage. Okay, so as I told, non-severe stage, the mild, pre-symptomatic, mild stage, they should be monitored for the virus together with the TB cell responses, with the immunomediators. So these scenarios should be considered when determining the strategies of vaccine development. And these things they have to concentrate when they develop the vaccine. The next biggest challenge is cytokine storm and release syndrome seems to affect the patients with severe conditions. Since lymphocytopenia is often seen in severe COVID-19 patients, the cytokine storm caused by SARS-CoV-2 virus has to be mediated by leukocytes other than T cells. As in patients receiving the CAR T therapy, a high WBC count is common, suggesting it in association with lymphocytopenia as a differential diagnostic criterion for COVID. They're taking a blood culture and they're looking for a complete blood count in COVID-19 patients. The reason is why they're looking for a complete blood count is, okay, you have to know this, you have to take this information. You have to look for total WBC count. Okay, that should not be that WBC count is high. The chance of cytokine storm and lung damage is more. Okay, it is more common. And the other thing is neutrophil and basophil ratio. So neutrophil and lymphocyte ratio, neutrophil and lymphocyte ratio, that has to be 3:1. So these are the things where the doctors are looking for the blood reports and trying to predict their problems, which these patients they develop severe lung damage, and these patients are very mild category. So challenge: how to stop COVID-19's killer cytokine storm? How we are going to stop this? Okay, so these are the medicines. This is just for your information. So these are the medicines is going for the trunk of the tree. So one of the most promising studies published in Science cuts off the cytokines at their source in the immune reinforcement themselves. Out of 11 patients treated with the drug who needed supplemental oxygen, 8 patients regained breathing ability and returned home. Okay, so whoever taken that drugs. So out of 8 patients on ventilators, and 2 were able to come off their missions, that is weaned off from the ventilators. Okay, so I don't want to again give any negative information here. I'll just go to the next slide. So this drug, which is manufactured by Swiss pharmaceutical Swiss company, it is an immunosuppressant used in the treatment of rheumatoid arthritis. So among other arthritis. So according to the American College of Rheumatology, the drug treats arthritis by inhibiting the IL-6 protein, the same protein that in COVID-19 patients may lead to a cytokine storm. And I want to tell you one more information. So people who have got, who feel that they are exposed to this virus, and who feels that if you have a fear of getting tested positive, the simple thing is you can go and check IL-6. Okay, so inflammatory IL-6 proteins will give a clear picture that you have got COVID, you are COVID positive or not. So based on that report also, the doctors can predict that you are positive or negative. Okay, so this protein in the COVID-19 patients may lead to a cytokine storm, and you should not neglect. Okay, so you should not think I'm not exposed, I don't have this COVID-2 problem, I'm not positive. If suppose your IL-6 is wrong, okay, there is a chance of developing the cytokine storm. So that is the reason the patients getting admitted in the preliminary or in the pre-symptomatic stage, they are taking all these investigations and ruling out that these patients will not go to the severe stage and they're done early. Next is prazosin, blood medicines, making the drug a promising candidate to prevent a cytokine storm. And one more medicine called baricitinib, and this medicine lowers the levels of cytokines. And these are the medicines, okay, these are all the medical rehabilitation medical team trying to stop the cytokine storm, and that is the killer for the COVID-2. And the last important thing is vitamin B3. So lung damage is a major hurdle to recovery in those severe patients. It is important to mention that various studies have shown that in animal models with bleomycin-induced lung injury, vitamin B3 or niacin or nicotinamide is highly effective in preventing lung tissue damage. Okay, so you can advise the patients to take vitamin B3. and that is very highly effective in preventing the lung tissue damage. Yeah. So next, coming to the genetic problem. So HLA haplotypes and SARS-CoV-2 infection. So this is a HLA molecule which is increased binding specificities to the SARS-CoV-2 virus peptides on the surface of the antigen presenting cells. So they are taking only your antigen and antibodies from the nose swab and then the throat swab. So these antigen receptors, no, the HLA haplotypes are binded very closely to this antigen. So the susceptibility to various infection diseases such as tuberculosis, leprosy, AIDS, even AIDS, no. So hepatitis B, influenza associated with specific HLA haplotypes. And we have to rule out the different, so particular murine MHC class 2 haplotypes are associated with the susceptibility to influenza. So in man, HLA class 1 is also associated with H1N1 infections. So there are lots of these haplotypes are already susceptible to other infections. So what is challenge here? It is imperative to study whether specific HLA loci are associated with the development of anti-SARS-CoV-2 immunity, and if so, to identify these alleles, either class 1 or class 2, that demonstrate induction or protective immunity. So once the dominant alleles are identified, simple detection kits can be developed. Okay, so that is a big challenge in the research going on, and I'll tell you what is the advantage of this identification of the gene dominance. So the challenge is scientists find genes can determine if you are at higher risk for fatal COVID-19. A new study just released by the American Society for Microbiology is suggesting that gene variation in people's immune system play a big role in explaining these case-by-case discrepancies. Already I told you, a person who is very healthy, you may be thinking, okay, he is very healthy, but how he developed this COVID-2 virus? Okay, because of the genetic focused on the immune system genes known as human leukocyte antigen genes. Okay, HLA haplotypes. Human leukocyte antigen genes is called HLA haplotype. These genes are highly involved in the human's immune response system, and that ability to recognize pathogens, but they come in a variety of forms and vary from person to person. And the study's authors also believe this could be a great way to predict which patients will develop more severe coronavirus symptoms and require extra care. So once if they come out of this research, they will be able to identify, they'll be able to predict which patients will develop more severe states. Okay, they'll go to the more severe states. Which patients will develop only less severe states. Okay, so by identifying their genes. So still research is going on. So the study concludes that pairing HLA typing with COVID-19 testing where feasible would improve assessment of viral severity in the population. Now, what is the big challenge here? Why I'm talking all this here? What is the big challenge here? Now, the entire world is trying to develop vaccine. Okay, so they can do a research by giving a vaccine to this particularly type of HLA haplotype gene patients and associated with COVID-19. Okay, so if they combine both the things, okay, they have to pick up the HLA haplotype gene patients, and they are associated with COVID-2 positive, and they can try vaccine for them. They can give priority for them. Okay, so vaccine, they can try vaccines for them, and they can do trials. Okay, so then the exact health benefit of vaccines will be clear. Okay. So following the development of the vaccine, individuals with high-risk HLA types could be prioritized for the vaccination. That is what I want to strongly. Challenge is what? Hyaluronan, a potential cause of fatalities. Okay, hyaluronan is the potential cause of fatalities. It is a potential cause, the innate immune response to tissue damage caused by the virus that leads to acute respiratory distress syndrome, in which respiratory failure is characterized by the rapid onset of widespread inflammation in the lungs and subsequent fatality. Okay, there are lots of news, maybe you would also have heard. Even I heard one of my friend's mother, completely she was normal, she was all right. Okay, she got tested positive just morning by 9:30 or 10 o'clock. Afternoon, that lady was no more. This is the potential cause of fatality. Okay, so again, that lady is not admitted to the lung inflammation, or there is there is no time for the incubation period going to the mild stage and then to the severe stage. But the problem is that it has a rapid onset of widespread inflammation in the lungs and subsequent fatality. Okay. So the symptom of ARDS patients include short rapid breathing and cyanosis. Severe patients admitted to ICU often require mechanical ventilators, and those unable to breathe, they are connected to the extracorporeal membrane oxygenation to support life. And CT image reveals that there are characteristics containing fluid in the lungs. Okay, that is the reason the doctors are taking CT scan immediately once they, that is for the old age people and for the comorbidity people, once they have tested positive, they're immediately advising them to go for the CT scan. They're looking, so opacity is what that covers entire lungs. Okay, it covers entire lungs, or there is excess mucus in the lungs, there is inflammation in the lungs. So this hyaluronan is the fatality, and that is the challenge here. And recent autopsies also have confirmed that lungs are filled with clear liquid jelly, much resembling the lungs of wet drowning. Okay, so autopsy studies have done, and they are trying to match up that these lungs or wet drowning. During SARS infection, the production and regulation of hyaluronan is defective. So that is the problem here. Okay, so once the patient has got infected, the production and regulation is defective. So importantly, the hyaluronan has the ability to absorb water up to 1,000 times. If that is defective, what happens? Your lungs is drowned. The lungs is well drowned. Okay, so therefore, reducing the presence or inhibiting the production of hyaluronan holds a great promise in helping the COVID-19 patients breathe. The doctor is also using a clinically proved bile therapy drug, and these are all the medicines. I'll just quickly read out. Lipopolysaccharides induced lung inflammation can be relieved by 4-methyl-amylifrone, and lipopolysaccharide is a pyrogenic. Okay, so pyro means what? Fever. Okay, responsible for fever, and also causes endotoxic shock. So also known as endotoxin, it is responsible for toxic effects. So the problem is what in hyaluronan, people getting immediately toxic and shock. Okay, so that embolic shock, we call it as pulmonary. So immediately that leads to the massive cardiac arrest. So also known as endotoxin, it is responsible for toxic effect, this drug. And 4-MU and its chemical derivatives exist widely in various herbs. That is the reason traditional Chinese medicines, which may explain the observed effectiveness of combined herbal medicine in some patients. Here also the Ayurvedic medicines are also working out. No, the homeopathic medicines are also working. The Ayurvedic medicines are also working. They also have this chemical derivative. Overall synopsis is based on some clinical common sense, and we believe that the two-phase division is very important. The first phase is what? Immune defense-based protective phase, and the second phase is, so first phase is what? The incubation period and very early mild stage. The second phase is severe stage where the lungs are getting inflamed and storm which affects the lungs. So doctors should try to, they're already doing it, trying to boost the immune response during the first phase. And already I told you the vitamin B3 is highly lung protective. This is just a summary. You can use controlled coughing, so try to reduce the stress. And doctors are trying to immune the response during the first phase, and hyaluronan, they're trying to boost up the hyaluronan protein. And HLA prototyping is very important. HLA haplotype, human leukocyte antigen, and that is related to the genes. And they have to before bringing out the vaccine, they can try vaccines, really successful on this particular genotype of people. And these are all the schematic representation of the progression of COVID-19 infection. And on the right side, it is severe stage, and on the left side, it is early stage. The activated T cells, the alveolar macrophage, and the neutrophils. Okay, so all these are the immune responses and how it is affected in the severe stage. This is the picture. And what we have to learn and react after an incubation period, the invading COVID non-symptoms and elicit effective immune response. So once you are in incubation period and once you feel that you have a light fever, you have to improve your immune response. And yeah, so if the general health status and the HLA haplotype of the infected individual do not eliminate the virus, the patient then enters into the severe stage. When strong damaging inflammatory response occurs, especially in the lungs, at this stage, inhibition of hyaluronan synthesis and elimination of hyaluronan can be prescribed. So cytokine-activated mesenchymal stem cells can be used to block inflammation and promote tissue reparation. And vitamin B3 can be given to the patient starting to have lung CT image abnormalities. Okay, so once it is found lung CT image abnormalities, you can the patients can start taking vitamin B3. And then patient challenges following COVID-19. I think slightly it was explained by the previous speaker, Dr. Vishwanath Reddy. So there are lots of cognitive impairments. Okay, now going to a different scene. So just think about the SP Balasubramanian, who is there in a long period for in the ventilator and in the ICU. Okay, so in the critical stage. So what is the dark side of ventilators? Okay, so what is the challenge here for the patients? So for those who manage to defeat the virus and come off ventilator, the really hard part begins. Okay, once you think, okay, the patient is coming, because lots of challenges for the physiotherapist and for the rehabilitation team to bring them completely functional. So many will suffer long-term physical, mental, emotional issues according to staggering body of medical and scientific studies. So challenge is what? What is ventilator-associated pneumonia and how to prevent it? What is ventilator-associated pneumonia? Ventilator-associated pneumonia is defined as an airway infection that develops more than 48 hours after the patient has intubated to the ventilator, which indicates that it was not present or developing at the time of intubation. Okay, it is the ventilator-associated pneumonia. Once they're intubated to the ventilator, the people will develop pneumonian symptoms. So top 3 recommendations for ventilator-associated pneumonia prevention: practice good hand hygiene. This is for the nurse team and for the physiotherapists who are treating the patients in the ICU. So always clean your hands with soap and water and alcohol-based sanitizer, and maintain the patient's oral hygiene. And this can help to prevent bacterial colonization of the endotracheal tube, and maintain the patient's semi-recombination position, okay, half-lying position. So next challenge is what? Prolonged ICU stay. Psychological support is much required for them. So early indications suggest that COVID-19 patients will need even more psychological support than typical ICU patients. Okay, so when compared to typical ICU patients, the COVID-19 patients need even more psychological support because of high levels of survivor's guilt. Okay, they have got survivor's guilt and post-traumatic stress disorder. Okay, so it is not the management of the rehabilitation team is not over with the patients coming out of the ICU. So after also lots of skills required. So physical effects, a large percentage